So this is a results panel of a newer style of gut microbiome testing I'm now routinely using with my clients. And these results are for an individual I'm working with who has endometriosis and also a wide range of gut symptoms. So there are quite a number of significant markers here that are out of range. And especially in the context of endometriosis, I'm interested in whether or not there is an overgrowth of LPS producing microbes, which you can see down the bottom has been picked up in this case. Because LPS producing bacteria, if there's an overgrowth of them combined with poor gut wall integrity or leaky gut and gut wall inflammation, the LPS, which is a toxin, gets into the bloodstream and drives chronic inflammation. And this will continue to aggravate and worsen endometriosis and gut symptoms. So with these microbiome results, I can go into the bacterial species database and find out exactly which species of bacteria are LPS producers. And here you can see that there are three. What is most relevant here, as is highlighted with the red stop sign looking icon, is that there is an overgrowth of Escherichia coli, or E. coli, which is part of the Proteobacteria phylum of bacteria, which are all notorious LPS producers. And so their levels of E. coli are 0.13%, which is quite high. We want to get E. coli down to under 0.01%. So treatment for this has been focused heavily on reducing levels of E. coli with some targeted treatments for that. And this one can really take a while to get down. And so if we go back to the results panel, we can see there are some other markers out of range. So in this case, you can see at the top that the fecal pH levels are quite low, which suggests this person has a very rapid gut transit time. So things are moving through the gut too quickly, which is going to highlight that there's absolutely a lot of gut malabsorption going on, which we don't want. They have an elevation of secretory IgA, which is a marker of gut immune activity. So 80% of our immune system is in our gut, and high levels of this is suggestive of a handful of potential issues, the main ones being underlying gut inflammation. It can also be related to food allergy or sensitivity, signifies gut dysbiosis. Sometimes it can be an infection, bacterial or viral, and there may be autoimmunity going on as well. So that needs to be analyzed in the context of the person. You can see their microbial diversity is quite low. So this is a measure not just of the amount of bacterial species they have, but the spread and variety of these. So getting their diversity higher is important to restore their entire gut ecosystem. So we need to treat gut dysbiosis or bacterial imbalances, particularly with a focus on feeding the quote-unquote good or beneficial bacteria. And in the borderline section, there is an elevation of something called calprotectin. So this is a marker of quite significant gut wall inflammation. So this is the value of comprehensive microbiome testing in directing treatment properly and taking the guesswork out for people and getting them answers of how the state of their microbiome may be contributing to their symptoms. We use the comprehensive bacterial species database to draw up reports of all of the relevant bacteria for them that are out of balance. So for example, in this case, I'm always looking at what people's levels of a bacteria called Bacterium prausnitzii are. In this person's case, they're sitting at about 6%, a combination of those top two. We really want them at about 10 to 15% because these bacterial species are very beneficial. They're very highly anti-inflammatory.